Does ice really help with low back pain? There's a lot of controversy right now, from ice baths to taking cold showers first thing in the morning to using ice packs to the fact that rice is no longer applicable. And all of my patients are wondering, does ice actually help, and when should I use it for my low back pain? So that's what we're going to talk about today. This was prompted specifically by an article where a lot of researchers, in fact, the one who came up with the whole rice principle, rest, ice, compression, and elevation, was saying we now know that that's not the right thing. Now, if you're up in arms about that, let me explain. The research clearly shows that functional activity and keeping moving as much as you can pain-free is what actually allows your tissues to heal. However, it is still important to take a rest for short periods of time, particularly if you have a sprain. So if you have an ankle sprain, or if you have a sprain of the muscles in your low back, it is still okay to do that kind of rice principle, rest, ice, compression, and elevation for a day or two while the inflammation is going down. It is important to help your body deal with that inflammation during that time in a protected way. But the problem is that people have been taught to do that for 2 weeks or so, which is way too long, because what happens is that inflammation gets stuck in there because you're not moving enough. Then that leads to scar tissue. So in today's video, we're going to cover common misconceptions regarding ice. We're going to discuss the difference between systemic ice and local ice. We're going to discuss the goals of icing, and then how long you actually should be icing for. Ready? Let's go. First thing, discussing the common misconceptions around ice. So many people feel like they need to use ice to decrease inflammation. There's two misconceptions with that. One is that ice actually does decrease the inflammation. We're not actually sure that that's true. The research does not clearly prove that. In fact, it actually says that maybe it increases inflammation because people keep the ice on for too long, and then you have less blood flow to that area. And when you have less blood flow to that area, you have less of the cells coming in that can help clear everything out. So when people put ice on for long periods of time, like hours, like those ice sleeves that you really, get that good ice coming through the whole time, that actually may be too much. It's even not indicated often after surgery, because too much of a good thing, even ice, can be too much of a good thing. Now, what we do want to use ice for is for brief periods of time to help to decrease that inflammation so the body doesn't get overwhelmed, so that the body has the opportunity to decrease the pain so we can get moving. Now, local ice application versus a systemic ice application. So your systemic ice application is when it affects the entire system. So you're talking about your ice baths, you're talking about your ice showers, your ice plunges, things like that. Now, does that really help? When it comes to inflammation, there's no indication that it does actually help. A lot of people who do that see other benefits. They feel like it affects their nervous system. It helps them get charged up for the day, things like that. If you're doing it for that, that's fine if it works for you. But if you're using it for inflammation, that's not the best way to do it, because we don't want to decrease the blood flow throughout the entire system. Instead, what we want to do is a local application. So we want to use that ice pack specifically on the area of pain to make sure that we have decreased inflammation, but we only want to do it for a short period of time. We want to help the body deal with the inflammation, but not decrease the blood flow to the area. So what is the real goal of ice? If it doesn't really decrease inflammation, what does it do? It decreases pain. It's basically like taking an over-the-counter medication in that it decreases pain for a brief period of time. But the important thing about that is that when your pain is decreased for a short period of time, you're able to get moving. And the movement is what's going to help heal you, as long as it's correct movement. Now, we still have to be careful when it comes to the low back, because if you're having pain, there's a chance that you're not moving correctly. So we do still need to make sure that we're being careful with our movements when we have a low back strain or when there's any pain in that area. All right, so with all this talk about ice, is it good? Is it bad? I hope you've learned that you can use it for short periods of time as long as you do a local application. But how long is a short period of time? What the research indicates is using it for 3 to 5 minutes is really what you need for the pain inhibition. That means that the pain is going to be decreased. Then you want to get up and do some gentle movements. Now, gentle pain-free movement is what we're going for here, because if you cause pain, then that starts the whole cycle again, right? That whole inflammatory cycle starts. So we have to eliminate the pain with the movement and stay in that pain-free motion. That's why we just want to do the ice for 3 to 5 minutes. Then you can put the pack back in the freezer, move around the house a little bit, and get that blood flow to that area while you have that pain-free motion. Now, if you're wondering what's causing your low back pain in particular, I'm going to recommend that you check out this video here. If you have more questions regarding back pain or even just general health tips, I definitely recommend checking out my book, Movement is Life. We'll drop a link below.